Medicare Advantage or Medicare Disadvantage? Today I'm going to give you the hidden truths behind the most popular type of Medicare plan. My name is Colin Wattenville, and I have been in the insurance industry since 2016, and now I own and operate an insurance agency currently based out of Omaha, Nebraska. I have a team of agents working underneath me, and I've personally helped over 1,000 individuals and families with their health insurance, Medicare, and employee benefits needs. All right, let's talk about Medicare. For simplicity's sake, just know that there are two routes you can go down when enrolling in Medicare. You can do the traditional Medicare route, or you can opt into a Medicare Advantage plan. And this video will be talking exclusively about the latter, the Medicare Advantage program. Regardless of what you've heard about that program, as I've already alluded to, know that at the time of recording, more than half of everybody on Medicare has opted into the Medicare Advantage program. And that right there is something I am constantly reminding people of. You will hear a lot of bad things about, well, health insurance in general, but especially about Medicare and even Medicare Advantage plans more specifically. There are a lot of misconceptions and misnomers out there, but at the end of the day, when anybody challenges me or challenges the integrity of these types of programs, I'm very quick to remind them that over half of everybody on Medicare is currently enrolled in a Medicare Advantage plan. So if these plans are so bad, if these programs are not serving customers well, then riddle me this. Why is more than half of everybody on Medicare enrolled in one of these plans? Food for thought. Now, I wanted to make this video today because I am quite frankly sick of seeing posts on social media or different advertisements talking about these programs that are just not factual whatsoever. Now, the vast majority of the time, the complaints, disadvantages, and misinformation being thrown around online about Medicare Advantage plans comes down to three main issues: networks, prior authorizations, and payments for services. Now, in terms of network issues, quite frankly, that's on the agent or the consumer. A lot of times these plans have very broad networks. Quite frankly, even HMO plans, like in my home city, most of the health systems are covered under majority of the plans. But it comes down to bad agents not doing their due diligence and their homework, or if the consumer is shopping on their own, them not knowing how to navigate everything to check to make sure all their doctors are covered by the Medicare Advantage plan they're choosing. Also, most of the plans now include travel benefits, so even if you're traveling across the country or if you live in a different part of the country for 3 months out of the year, a lot of snowbirds where I'm at, moving from the Midwest down to Arizona or Florida for the winter, right? Their Medicare Advantage plans still actually cover them most of the time. So network issues, that's an easy fix. Get a better agent and make sure they are doing their homework for you to check and see if all your doctors are covered by your plan. Prior authorizations, that's a whole nother beast. That is the biggest complaint that I probably see people talking about when it comes to Medicare Advantage plans online. Now, it's important to remember, no matter which routes you have, traditional Medicare or Medicare Advantage, you're always going to need prior authorization for certain services. But if you have traditional Medicare, which is run and facilitated by the government, they're obviously not going to do all the checks and balances, and they're going to approve things a lot quicker. And maybe that even shouldn't necessarily be approved just because they don't have the manpower to check everyone, right? There's a lot of people on Medicare and very few government employees. And at the end of the day, the government's not an insurance company, so it's not their money. They don't really care what's approved and what's not. So a lot of times if something gets pushed through them, they'll just stamp it and say, okay, that's approved. The doctor says they need this procedure, we'll pay for it. It's government money, it's tax dollar money. Whereas the private insurance company, they're going to make sure that the service is actually needed. They're going to see if the patient has done maybe a less invasive procedure or did an MRI or an extra scan before going into the operating room, before going under the knife, right? Because insurance companies, they're doing their checks and balances and they're making sure that their money is being spent wisely and that there's not fraud, waste, and abuse going on where providers are just trying to bill for the most expensive service right off of the bat. And the last main disadvantage that I hear people talking about when it comes to Medicare Advantage plans is in relation to how well these plans pay for different care, different services, different surgeries, things like that. First and foremost, let's get this out of the way. By law, Medicare Advantage plans have to have as good of coverage as traditional Medicare. And after being in this industry for many years now, I actually have yet to see any Medicare Advantage plan that does not have better coverage than traditional Medicare. So by definition, Medicare Advantage plans have to have at least the same amount of coverage as traditional Medicare. But the missing piece, again, misinformation that goes untalked about online, is that someone on traditional Medicare 99% of the time has a secondary plan on top of that called a Medicare supplement that fills in all those gaps of traditional Medicare, meaning those that have traditional Medicare and a Medicare supplement, they are often seeing 95% plus of their bills being entirely covered because they are paying a lot more month to month and have an additional plan on top of their traditional Medicare. Whereas those on a Medicare Advantage plan typically just have a Medicare Advantage plan and nothing else to fill in the gaps, the out-of-pocket costs of their Advantage plan. So by definition, those patients that have Medicare Advantage plans, they are typically going to be paying more copays when receiving care. They might pay a copay for a doctor visit, or they might pay a few $100s for an outpatient surgery compared to somebody on traditional Medicare with a supplement that covers all except for maybe $200 of their bills. So while yes, typically those with the Medicare Advantage plan have more out-of-pocket costs, they pay more as they go in terms of their healthcare needs. They have more copays, more out-of-pocket costs than somebody with traditional Medicare and a supplement. The person that has traditional Medicare and a supplement is paying a lot more month to month. That's why me personally, I describe traditional Medicare with the supplement as pay up front. You pay a lot more month to month and have less bills when you go to the doctor and hospital, versus Medicare Advantage. Those plans are quite often $0 a month. So of course you're going to have more out-of-pocket costs when you go and actually receive care. Medicare Advantage I consider more of as a pay-as-you-go type of plan. So while on paper, or if you're somebody working in the billing department of a medical facility, you might see somebody that has a Medicare Advantage plan and see that they're paying a lot more bills to the hospital and to the doctor. That's only one part of the picture, because those that are on an Advantage plan are probably not paying anything for that Advantage plan month to month, versus somebody that has traditional Medicare and a supplement. Their monthly costs for that setup is a lot higher, so by default they're going to have less bills that they pay to the provider, to the doctor. So to wrap things up, a lot of the disadvantages when it comes to Medicare Advantage programs that you see getting spewed out online comes down to majority either misinformation or misconceptions. As we already talked about, the first thing being networks. Just like all the other insurance plans you've had your entire life, like through your employer, Medicare Advantage plans are going to have networks, and it comes down to you and or your agent to do the due diligence and all the necessary homework to make sure your providers are going to be covered under whichever Medicare Advantage plan that you choose. Now, in terms of prior authorization, as we talked about, no matter which route you go down, traditional Medicare or Medicare Advantage, you're going to be subjected to prior authorizations for certain services or types of care. Again, much like every other health insurance you've had your entire life. Now, traditional Medicare is probably going to approve a lot more services and probably more quickly than Medicare Advantage plans, because traditional Medicare, they have unlimited tax dollars at their disposal, and quite frankly, they don't have the manpower to look for and find all of the fraud, waste, and abuse going on in the insurance and healthcare field. Whereas Medicare Advantage plans, they don't have unlimited tax dollars, so they're going to be a lot more cautious and a lot more picky and make sure that, hey, if a provider is requesting an extended stay at a skilled nursing facility or a pretty intensive surgery, they're going to make sure that not only is that care absolutely needed, but that care is helping the patient get better. And then last but not least, the third most popular complaint or disadvantage around Medicare Advantage plans is that they don't pay as well or as much as traditional Medicare, which, as we discussed, is just completely false and also doesn't take into account the full picture. While someone on a Medicare Advantage plan might see more out-of-pocket cost at the point of service, at the provider's office, at the hospital, the person on traditional Medicare has a lot more month-to-month costs. So in other words, again, think of Medicare Advantage as pay-as-you-go versus someone on traditional Medicare with a supplement as being someone who pays more up front. In other words, a Medicare Advantage plan is a completely viable option. There are going to be disadvantages with them, just like with traditional Medicare. That's why it is important to work with a licensed agent who can listen to your needs, does the homework for you, and make sure that whichever route you're going down, you know what you're getting yourself into, and it's going to be the best fit for you and your needs. If you enjoyed this video or found it useful in any way, if you maybe learned something new, it'd mean the world if you hit the like button, followed us on your favorite social media platform, or even subscribed. We are always posting out content about all things health insurance, Medicare, and employee benefits. So stay tuned for more content like this, and thanks for watching.